Hi, everyone. Welcome to Living Well with Dr. John, Adjustment Through the Lifespan. Today's topic is an interview with Dr. Lee. Two quick notes before we begin. Today's webinar is being recorded and will be available on the Reeve Foundation YouTube channel. Additionally, to turn on closed captioning, please click the CC button on the bottom of your Zoom screen. Before we begin, I'm going to share two webinar disclaimers. The first is, this is for educational purposes only. For psychological services, please contact your state psychological association for referral. The second disclaimer is the questions, comments, and opinions expressed during the webinar may not express the views and beliefs of the Christopher and Dana Reeve Foundation. Now for some background on Dr. Lee and Dr. John. Lee is a double board certified physician in spinal cord injury medicine and physical medicine rehabilitation with expertise in non-traumatic and traumatic spinal cord injuries. Dr. John is a clinical psychologist and is board certified in rehabilitation psychology. He's professor of psychology at East Stroudsburg University, as well as a counseling psychologist. Dr. Chang also has a private practice through Doctors on Demand. Now I'm going to turn it over to Dr. John. Hi, Dr. John.
Good afternoon, everyone, and good morning in the West Coast. Thank you for joining me today on our interview process here. We're doing something very different. Well, first of all, I have to thank, actually, I forgot. I almost jumped right into it because I'm so nervous about this new process that I skipped my intro. Thank you, Foundation, for supporting this cause. It gives me an opportunity each month to bring up a topic I think that'd be relevant to adjustment through the lifespan of us spinal cord injured individuals. In addition, I want to thank Angela and Julie today for helping me make this happen. Without the help of Julie and Angela from the foundation, I could not make this work. A shout out to my colleague, Pat, down there in Virginia, West Virginia. Thank you for supporting this as well, Dr. McMahon down there. So here's what we're doing today, and you're gonna have to let me know if this makes sense today. I had an opportunity to talk to Dr. Lee, who works with individuals with spinal cord injury in California, and unfortunately, she was not able to come on live due to her schedule. So what I did do is I met with her. We recorded a few of my questions ahead of time, and I'm going to play some of these videos, clips, and then I'll talk about it. I'll discuss it. If you have any questions in the process of during the videos, please post them on the chat, and I can address them. And now, obviously, we cannot ask Dr. Lee live questions. I was hoping to do that down the road with her in the future. She might come on. But for now, we're just gonna base it on her questions and answers on the video. So the first thing I am going to talk about for her was just the concept of spinal cord regeneration. I mean, are we close in figuring out how to cure this disease of being injured? You know, I am obviously interested. I think everyone who's been paralyzed is interested. So let me start by sharing you that first question with Dr. Lee about spinal cord regeneration and see if this works. Okay. Can you give me a brief synopsis of how close are we in finding a way to solve this paralysis problem? Are we close? Are we far? Can you give us a little talk about?
You know what, 2016, 2017, 18, when we were doing maybe phase 1 clinical studies, we were hoping 5 years, and 5 years already passed. I think we're a couple steps closer to it. I think the European country may come up with the clinical use sooner than us. Right now, the most of the advancement was made in actually implantable spinal cord stimulator, mainly done by Dr. Hatema at the University of Louisville, I believe, and also there's another researcher professor, Dr. Corti, Gregor Corti. I think he's in Switzerland based. Those two places are the main one actually doing really going forward. Both of them are focusing on the implantable. I think implantable may come out sooner than transcutaneous. I'm kind of hoping next 5 years. They're very close to doing clinical studies in mass scale. COVID definitely slowed it down because a lot of clinical study has been suspended because of fear of close encounters and stuff. But I see that movement, and I want it to come out yesterday, but it's not there yet.
Right.
But I feel, yeah, maybe next 5 years. I think we're very close, and there's a lot more publications and a lot more evidence in the scientific journals and field. So you may have met somebody who actually underwent clinical trials more often than back in 2000, because the first publication, I believe, came out 2004. And that one was, I think, maybe 1 year study. So maybe they started actual clinical study in human early 2000. And then, it was only 4 individuals at the beginning. And now I think there's more than 100 people who have been implanted and having a really good outcome. And there are multiple places, a little bit smaller scales, but those 2 places are the main one right now. So I'm kind of hoping next 5 years, it may come out in the European country first. Most of the times, the clinical device tends to come out in the European country first, not just the spinal cord injury, some other medical devices. I think they are a little bit more linear about the safety regulations. I think the FDA is a little bit more strict.
Yeah. All right, so I asked Dr. Lee, I mean, those who are on right now in the chat, give me a yes, no. Do you think about walking every day? I mean, is that something that comes to your mind every day of your life, like it does for me? And I'm already 35 years out, and does it? Okay, so a lot of you are, I'm getting a mix. Yes, a lot of no's. But for those who are spinal cord injured, who are paralyzed, and some of you on here may not be paralyzed, so it's not something you think about because you already have it. But those of us who are paralyzed, do you think about walking regularly? And for me, it would be a yes. Doesn't mean I'm right or wrong. I'm just, that's something I wish I could do. It was, I believe, when I was hurt in the initial years, they said to me, 5 years, there's going to be changes. There are going to be changes. And back then they were already working with cats, dogs, mice, rats, whatever. And, in hearing from Dr. Lee that another 5 years, maybe something will come out, especially from the Europeans. They are traditionally more advanced, more aggressive with their laws. FDA from our side tends to hold back, and we're more conservative, make sure nothing goes wrong. So it's a catch-22. She mentioned implantables. I have read that they're more focused on implanting devices that help you breathe, like diaphragm stimulators, and a lot of other type of implantables. So in retrospect, I guess I would never focus on walking as a source of your goals in life. It'd be nice. It's a great way of exercising. It's a great way of keeping your body in the proper alignment and motion and bladder issues and spasticity. But when it comes to functional walking and your ability to walk down in 5 years, it's not something that I would set as a goal for myself, only because I don't want to be disappointed. And I've been disappointed for what, 20 some years, 30 years now, and it hasn't gotten closer. So live life with what I have, I guess, is what I'm saying. So that was my first question to Dr. Lee. Are we close? And it sounds like we're still not there yet. We're still working with animal models, and translating from animal to human beings, it just doesn't work, seems to work. So at least not very well at this point. Okay. Okay, so spinal cord stimulators from University of Kentucky. Joe mentioned, so great. So there's maybe a good direction towards stimulators. Elon Musk is working on implantable as well as the Tesla guy. So I mean, he's a brilliant man. So hopefully, maybe he'll bring into some aspect of that. All right, so let's work with our second question with Dr. Lee here. So is that the second?
From my perspective, in managing quality of life for myself is pain management.
Yeah.
Can you give me a little synopsis of what you feel is the biggest hurdle for pain management with individuals with spinal cord injury, and what would you suggest, what we should be looking for?
I'm very well aware of challenging part of the pain management. Different scenarios. I have seen many patients in multiple medications, and we're not really sure which medication is really helping manage the pain and which medication may not be necessary. What I see is, I think the VA is actually pretty good because they have some centers have a comprehensive pain management clinic combined with psychologists and therapists and pharmacists and physicians. Complicating pain, those are key. I don't believe complicating chronic pain can be only managed by one modality, just the medication. No, just the one modality like a physical therapy. No, it has to combine everything because chronic pain is very complicated thing, and especially the nerve pain, and it fluctuates. So what I see often in the community is very plain, flat level of management. It's very different from the people with able-bodied people having pain. It's very different from people with a spinal cord injury having pain. And you can't manage this complicating chronic pain with a simple modality. That's almost impossible. So I highly believe, I don't know, I'm sure there's some studies going on looking into interdisciplinary pain management in spinal cord injury patient population may have a better outcome. That's one of the recommendations. If I have an ideal world with all the ideal healthcare system, that's what I want all of my patients who has a chronic neuropathic pain go to take care through the medication, therapy, counseling, and all those kind of things. It needs to be all combined. Goal is always using the minimum medication that you need. I really believe all the medication has a side effect. And when you take multiple medications, they may not even work well enough that one single medication is supposed to work. So there's a benefit of using different pain medication because it can target. So pain is something that our body has a receptor, and some of the chemical binds it and send a pain signal. Pain is not just the one big receptor saying pain. The pain receptors are many different kinds. There's like a GABA receptor, Reeve receptor, and all these other receptors. One of the theory is try to blocking all these different receptors may work better. It kind of goes back and forth. But what I see in my patients is The spinal cord injury pain is very uniquely tied into spasm if you have an upper murmur condition. If you have a pain, it can cause spasm. If you have a spasm, it can cause pain. So depending on what kind of pain you have, unless you address all the things related to the pain, just treating the pain is not going to make your pain better managed. So it really means a person or a team really understand whole perspective of the spinal cord injury pain. That's very necessary. I'm curious in major spinal cord model system. I haven't looked into it. I'm sure some centers may have a very well-managed comprehensive pain system. I think that's the way to go with a minimal medication as much as possible.
So here you have it. And those of you who are with spinal cord injury, or those of you without spinal cord injury, do you have any pain right now? In your chat, let me know, do you suffer from pain right now as we speak? And as you heard from Dr. Lee, pain for individual with spinal cord injury is very complicated. It comes from everywhere, from spasticity, as she talks about, from location of your injury. I wrote a chapter in a book about pain management once, where about 50% of 50% of your pain is psychological. So you have to really calm the brain, find ways to distract, not only taking medication, but taking the right types. So pain is something that truly, when we talk about quality of life for an individual with spinal cord injury, pain is a huge inhibitor of our quality of life. As a rehab psychologist, I could probably treat almost any disorder, but if you have really chronic pain, that's a tough one. It's tough to have a good quality of life when you're suffering so much from the pain and spasticity. So in her eyes, in her suggestion, she says, look, you can't just go to a general medical doctor and say, let's treat my pain. We're too complicated. You need to go to a good spinal cord model system. She said, in her ideal world, you have the medical, you have the therapy, physical, occupational, you have psychology, social work, all of us acting on one issue, which is pain management. Okay. As a person who's learning about prescription privileges and et cetera, there's so many different medications out there that can impact your pain. There's certain doses that you need to take to keep it going, but there's also a habituation. If you take this over time, your body's going to get used to it. So cycling through different meds is necessary so you don't habituate. But again, ultimately, as a psychologist, if you're distracted, that's one. If you're watching a movie, having a good conversation, all of a sudden you don't have the pain. So you have to find ways to distract it. The more you sit around and think about your problems and your pain, the worse the pain gets. I'll tell you, if I sit around and I have a bad day and I'm just sitting thinking about all these issues, it's just going to get worse. So you have to stay distracted, stay busy, learn how to meditate, do yoga, any of those mental processes that distract your mind. Some of my friends take anti-anxiety medications, which helps with alleviating some of the pain. Others uses medical marijuana. That's what they do, and that alleviates some of their pain as well. So I'm not sure what your thoughts on medical marijuana, but it seems to work for some people. So So spinal cord injury, regeneration, and pain. I think those were two of my top areas that I wanted to get her perspective on. Okay, so we're going to go to question number 3 now. Is
Another area that in our life is our bowel management. I mean, I hear so much in the Facebook how that literally controls our life. You know, we don't travel, we don't, our quality of life is so poor because of it.
Yeah.
When I saw someone posted one time, what is your biggest fear in having a spinal cord? And someone wrote, having an accident. I mean, that is the most socially embarrassing thing you can do. And everyone else chimed in, I agree. You know, 1,000 likes.
Yeah.
From, you know, from your perspective, what would be some key things you want us to make sure we do to make it work for us? Is there anything that you think in your clinical skills that makes sense to keep an eye on?
So, you know, acute injury, patients in the acute, individuals in the acute injury, the body changes quite a bit. So it takes some time to get having a routine. And once you go home and you have a daily routine, I have seen, you know, individuals doesn't have to do bowel care every day or every other day, still works. I think the key is finding what works best for each individual is important. Being aware of your own body, what kind of a food makes your bowel more loose or more constipated, and what medication works well for you. It's not like a one, you know, couple cocktails of a bowel medication, you know, Senna, Poise, Miralax, lactose, whatever. It's not one prescription fits all. Most of the people with the spinal cord injury, they eventually develop the sense of what works and what does not work. And I often respect my patients' feedback. And also I try to educate my patients that I don't have a really good sense how much education you get when you actually have an initial injury, like the impact of the spinal cord injury in bowel function. Did they explain that, you know, the motility of the gut slows down? Even you feel like you're having bowel movement, you still need to be on a regular scheduled bowel care, or so that you can train your body in a new condition. Sometimes it takes multiple education, and it takes some skilled nursing and expertise in that area. I'm curious how many people with a spinal cord injury actually having that education resources available. Then when you don't have a really good understanding, it causes a lot of confusion because you feel like, oh, why am I having this problem? I mean, I can see that I don't have a strength in my legs, so I don't walk, I understand. But most of the people, even my residents, young doctors, don't relate, even other doctors too, don't relate that having a weakness in leg can also cause the change in function in their bowel bladder function. A lot of clinicians, a lot of people don't connect those two things together. So a lot of people with a knee injury, they think like, oh, I can see that I don't move my leg, but why am I not being able to manage bowel bladder? So that realization kind of comes later on, and they struggle a lot because I think it's a lack of education or not understanding fully what to expect. That causes a lot of frustration and suffering and even angry because like, why am I not being able to do this?
So bowel management, as Dr. Lee mentioned, it changes our lives. I want to ask on the chat right now, if you have a spinal cord injury, does your bowel management control your life? Does it dictate everything you do? I'm not gonna, I'll probably bias everybody by saying what I'm going to say, but as you've been listening to my podcast, this podcast is not about me not telling you what my opinions are. It's really about giving you facts. Ben, I still give you my opinion because I lived through it. And I'll tell you, it literally controlled my life because everywhere I went, I needed to know, can I have the caregiver? Again, this is a quadriplegic perspective. Paraplegics probably don't have some of these issues that I'm talking about. Who's going to get me in? Who's going to get? Is it accessible? Wheelchair? And most of the time, as she mentioned, you got to figure out what works. How much water do you need to drink? How much laxatives do you need to take every day to make it happen? Now, my life, my routine used to be, at the night. I used to do it at night. And then I found out that waiting to the end of the day was just not doable. So I switched it to daytime, which means getting up early, getting it all done. It's almost a chore to have to do it before you get started with your school work and your work in general. I have to say, it is the most embarrassing thing to have happen if you have an accident. After many years of going through that, and if you've watched any of my old podcasts, it put me to a point of I have a colostomy. And when I read information about getting a colostomy before I got it, I've seen a lot of individuals with spinal cord injury say, wow, I wish I had done it 7 years ago, or I wish I've done it many years ago. I don't think a major surgery like that is something you can do quickly. You have to get to a point where you're so frustrated with your bowels that you're willing to take this other surgery. But once you have it, yeah, there are inconveniences having to take care of it, but my God, I don't have to deal with that morning ritual of sitting on a toilet for so many hours. So there's definitely a plus minus to it. And you have to really sell it to yourself if you're going to go that route. But in addressing Dr. Lee's, she said, look, education, you need to understand about it. You need to understand about it before you leave rehab. I don't think I understood how big of an impact the Bowel program was going to be in my life and my quality of life. So if you've never gone through a rehab, you need to go figure it. You need to contact somebody and help you figure out how to manage it for now. Those who are currently in rehab, learn, because I don't think they do enough justice to realize how much bowel routine will impact your quality of life. So a question from Joe is, can I maintain? And the answer is not independently. I've had others who could. I don't. I still require help from it. But the frustration and the level of help I need is a lot less with a colostomy than it is when I have to use the normal route. Okay, so Jennifer says, look, 39 years of a para, it still rules her life. Absolutely. If you don't have a great management, or even if you do, it just rules what you do and how you do it every day. So the quality of life is definitely less with this issue. Okay, great. We'll go to my next question.
Okay.
We went through pain, we went through bowel management. And the other third one is usually sexuality. A lot of people come out of the injury saying, there goes my life. There goes, I can't do it. I can't attract people. I can't have relationships. I know I'm throwing a lot of big questions at you because we're just meeting the first time. Any thoughts on this heavy topic?
So my talk about sexuality with the spinal cord injury is depending on the severity of the injury, if they have a significant weakness in lower extremities and bowel bladder, I say it's going to be different. It may not be exactly the same how you used to have intimacy with your partner, but it's not gone. It will be different. You just have to kind of figure out the way that works with you and for your partner together. I don't discourage that it's gone. There's nothing that you think you can enjoy. That's not really true. The sexuality, the intimacy, the core value or connection and the meaning of the intimacy is not just about the intercourse itself. There's a different things around of it. And in the beginning, it might be very strange and awkward because it's very different. But if you and your partner is on the same page and able to work through troubleshooting what's working, what's not working, what our each person's need is, if you can meet those ones, there are still intimacy.
All right, I'm just gonna lay it out there, okay? I know we all want to be positive here, and quality of life and sexuality is a huge aspect of our quality of life. Lay it out, I'm gonna just say it, it messes up our head when it comes to being paralyzed and sexuality. Now, intimacy, I'm all support. There's no limits of individual spinal cord injury when it comes to intimacy. The connection, the feeling love, the ability to relate to someone, the more meaningful psychological foundation part of sex. I threw it out there for us because I know, the big ones, being able to walk, bowel management, pain. The other one is sexuality, and it is definitely different. It is not the same. Does it cause individuals like me in life the fear, the anxiety of not being able to perform? Absolutely. I don't know how else to really say it than the fact that it sucks. It is not something you really, really want in your life. And it happens to us young men in our 20s and 19. And it's frustrating, I believe. And that's maybe my opinion. Now, I had a podcast where I had all these women on with spinal cord injury, and they said, yes, they can manage and do the things they needed to do to make it work with their partner. And that Dr. Lee's correct. You have to be able to work through it. You got to be able to talk about it. And through that, maybe the process of the intimacy can be ascertained. But the actual act of physical sex is definitely not the same anymore. And you will, man, you have to have an incredible mental health and mental stability to work through it, because it is a disappointment in life having this injury. So and that's just my opinion. Many of you may not agree with that. But when it comes to intimacy, yes, you can overcome that. When it comes to just the physical sexuality, it is definitely not something that's easily done and overwritten just using your mind. Okay, so I'm not even going to ask the question, is sexuality an issue for you? Because again, it's a very private statement and a personal goal that you need to figure out through maybe help with some people in rehab that has an understanding of that process. Okay, so all right, we have one last question, I believe, right?
At least throughout our talk so far, the importance of psychology, mental health therapists in the process of adjusting to life post-injury. What is your take on mental health? What is your take on the whole realm of their involvement and maybe even psychiatric meds? So can you give us a little bit about some of those areas?
The most important thing is the individual needs to be ready. Like when they're clinically depressed, then definitely yes, there's a need for the medications and counseling and everything. Similar to chronic pain, dealing with the trauma. Trauma doesn't have to be major trauma that, I got hit by a car. I was in the war. Those are major trauma. But no matter what happened to the people who have a spinal cord injury, whatever they go through is all trauma. It's a traumatic event. It's either from a medical condition or some complication from whatever. But those are major events that your identity changes. And I don't know how an individual can get through that process without help from outside. You have a physical health condition that you need to understand and learn how to take care of yourself. And on top of that, there's this psychological, emotional, mental part of it that got exploded with a major trauma, major changes, and you want to recover from that too. It's very complicating and heavy topics, heavy things to take care of. I don't think I'm going to be able to handle everything by myself, even mental health part of it. So when there's a clinical depression, definitely need to go see a psychiatrist and get on the right medication. As I jokingly said, everyone can use therapists. I completely agree using the therapist if it's needed. And sometimes peer support is very important.
Okay.
In my hospital, we have a, Triumph Foundation is California based. So we have a little, they call it ambassador or mentor from Triumph Foundation. So when I feel my patients are ready in acute phase, then I ask my social worker to reach out to them. Peer mentor comes and then they have a conversation. Most of the new patients with a new spinal cord injury, after meeting the mentor, they feel more hopeful.
So that was obviously a biased question on my side. How important is mental health? Well, let me ask you, do you think that every individual that has a significant impact, significant injury like spinal cord injury, do you feel that they should see a therapist? What do you think? Yes, no? Now, I'm going to say that because this is a very smart group of listeners who are probably biased with psychology, I'm hoping I'm going to get more yeses than no. But so think of it. You have a major injury. You're dealing with the loss every day. What can you do better? What can you do to overcome? How do you have a better quality of life? I'll tell you, I think I figured it out, being that I am so many years post-injury and that I'm a psychologist and that I train other people to be psychologists. I still struggle with it every day, with the thoughts and ideas that I wish and I could do. It's not something that just goes away. We are reminded every day of what we don't have by the people around us. And they walk around you, they grab up, they get things that, and for me, that is a constant reminder of what I lost. Having therapy to teach you. Now, I don't expect you to be in therapy the rest of your life. But I do hope that if someone is there to teach you how to fish, that Chinese proverb, teach you how to fish, you're fed for life. Give you a fish, you're only fed for a day. Well, I'm hoping that someone teaches you how to fish and how to get through this injury. But even myself, who's someone who should be adapting to my spinal cord injury, it's still a struggle. It's not easy. And And she mentioned mentors and peer mentors. Absolutely. I'm probably at my best when I'm hanging around other individuals with spinal cord injury, to share life about issues that comes up. So early on in your injury, they seem to give you a mentor. If they do, great. If they give you a therapist, even better. You work through it, but I believe it's the latter part down the road where you actually start experiencing life and having all these issues that comes up, that you end up needing a therapist, because it's a major life events that you start to realize how it has impacted you, your work, your marriage, if you have children, child rearing. Any of you out there who are a parent, you're an individual who have spinal cord injury and you're a parent and you're raising able-bodied children, I mean, that's a whole nother level of trying to understand who you are and what to do. So, yes. So mental health, important. Does it make sense? Absolutely. Peer mentors, yes. If they're available right in the beginning, if you don't have one, and join the groups. I'm on a few Facebook groups. I read a lot of their suggestions and try to see if does that make sense for me. You have to gear it towards what works for you. Okay, so those were the big questions I asked Dr. Lee. I was really thankful that she was willing to sit down with me in her busy schedule and talk about some of the big questions: regeneration, bowel management, pain management, sexuality, and mental health. Medication is definitely useful. I'm a big supporter of medication and psychological therapy. Research has shown that if you use those two combinations, you have the best results and the most quickest result. Okay. So thank you. On those questions, I'm going to read some of the pre-registration questions. If you have any questions right now that you want me to try to address that I can address, please put them on the chat. In the meantime, I will go through a few of the ones that's have already been sent to me. So one person says, any tips on how to stay positive, not only dealing with 26 years of spinal cord injury, but having a dysfunctional family? Oh boy, it's especially that second part, dysfunctional family. Well, here's my take on that. It's bad enough to have spinal cord injury, but when your family is messed up, oh my God, it just makes it so much worse. Any stress in a family will make the dysfunctional issue even worse. So you could have a perfect life with everything you need, and there still could be dysfunction in your family, some aspect of it. But if your life is good and you're doing okay, their dysfunction doesn't affect you as much. But if it's really bad and you're struggling with the spinal cord injury, a dysfunctional family would it'll be everywhere. And again, another way of needing that multiple team member to help. A lot of times people just don't know what to do or don't know how to do it. And they just need some education and communication, helping you learn how to communicate with your family members. So that's my, hopefully that's my take on that question. Another question says, how do I feel good about myself again? How can I make myself attractive to men my age, 60s? How can I learn to accept I need help from others? ADLs, IADLs. Oof, man, this is a loaded statements, these three questions. I'll start with the first one. How do I feel good about myself again? Well, the original Beatrice Wright, who's a rehab psychologist, one of the founder of rehab psychology says, look, to feel good about who you are, you need to de-emphasize physical aspects of your life and emphasize non-physical, other areas of your life that you have more or greater control. So what does that mean? Devalue. Well, it means, look, if you are going to put a value in your life because you want to play football or play a sport or ride a bike or join a gym, it's never going to happen. It's just you're always going to be impaired in some aspect of your paralysis. But if you start to emphasize your ability to lead people, your ability to work in a way that's not physically related, like for maybe like myself, who's an academic person, being a professor, you need to shift gears towards something more mental, cognitive, and away from physical. Now, here's the hard part. Some of you are incredibly physical individuals who that's your life. You know, you didn't emphasize intellectual or academic things or mental. And so it's a harder shift. But in order for you to feel good about yourself, you have to do something you can control. You have to have the ability to say, look, I did this and it's under my own power. And I try to do that with my patients as a therapist. I try to do that being a professor. How can I make myself attracted to men at my age at 60s? I'm assuming, I'm not sure if this is just completely a heterosexual question here's the problem with, at least when it comes to heterosexuality these days, it seems like people in their 60s, individuals in 60, the age, there's a difference in who's attracted to individuals 60s. You know, it never seems like people in the same age are attracted to the same. So 60s, so it could be anybody 50s, anybody in the 70s, a huge range. You need to find someone who's really going to be attracted to your personality, your humor, your ability to light up a room, and less your ability to, you know, dance the tango. I mean, so you have to really emphasize the emotional, the cognitive, your personal individual. Okay. Some research, and again, I don't know if this individual is a male or female, but at least for females with an injury, the more you have your ADLs and IADLs under control, the more the other individual don't have to physically take care of you, the more attracted you can be to finding a partner. At least that's one study says. I do tend to agree with that. Burning out your partner is a big thing. It can happen. It could be a deterrent. There are definitely a lot of relationships out there where the partner can overcome, but I'll tell you, eventually you're going to have to watch they don't burn out. So you have to keep that in mind, especially if you're an individual with significant disability like myself. So let's see. Another question. My son has a spinal cord injury. He's still struggling with bowel program and always have accidents. Again, if this is a consistent thing that's happening, then you need to consult with someone who can help understand the diet, the medication, the amount of exercise the person's having. Because obviously this is not what you want your life to be, having all these accidents and being embarrassed. So seek help. And there's a lot of good organizations and medical, and there's a lot of good literature about there. So, but you got to try different things. You have to, since it's not working now, you might as well try other things to see if it helps. Okay, that's my suggestion. Don't sit around and wait till another problem is going to happen. So let's see. What is your opinion about electrical stimulator to help manage pain? You know, again, a mechanical stimulator, I've read from others. I personally don't have one, but it appears to work for some people. Again, pain management is a complex issue. Some of you can use stimulator. Some of you can use medication. Some of you can use mental health treatment to have distraction techniques. Some of you may use, again, medication. So you need to try a bunch of different things. I can't say that just the fact of the electrical stimulator will help, but I do think that for some individuals, it would work for you. Okay. Let's see. Let's see, what is the, okay. I would like to convert my car to handheld brakes. So when I call place to have it done, I was referred to so many other people, like somebody to be an instructor. Somebody wouldn't do it unless I would have special class to learn. There are driving programs out there. I mean, I used to drive, and I'm a quadriplegic, and for many years of my life, that was the best thing ever, to be able to drive. I mean, geez, to go anywhere you want. Unfortunately, I lost my ability to drive after a while, after getting weaker. But learning how to drive and having the ability to drive is a utmost thing you should learn to do. Those of you who know that, how many of you out there who has a disability can drive? Give me a yes or no out there. I'm gonna say, to be able to drive is one of the greatest facets of adjusting to your disability. I mean, you can just go anywhere you want. And yeah, it's right. See, Brand C6, he's driving. I was a C5. I used to drive, and yeah, Jennifer says she can drive with a Brown ability chair topper. So Peter's says a script to drive. Awesome, Peter. Do it, Peter, because it will change your life once you can drive. So so I support driving. Be safe. You know, the funny thing is, though, is it may be in about 10 years, if I get to see that, I hope, we're gonna have all these automatic cars. Anyway, so I don't know. Do we need to learn how to drive down the road? I'm hoping not. I'm hoping I can just go into a car and say, hey, take me to a restaurant. And so that is, you know, that'd be the next in the future, I hope, for us automated drivers who need driving. Peter, I'm sorry about you having an accident while you're driving an Uber. So, but in general, driving is good as long as you don't get into an accident. Okay. Let's see. I am gonna, is it different kinds of low-tech affordable adaptive equipment for those with grip disabilities? Now, when I drove my van, I had what is called a tri-pin. It didn't really grab anything. It actually locked my wrist in, you know, onto the steering wheel. So it's pretty low tech when it comes to the mechanical things. But obviously it was connected to a whole bunch of other systems. Steering wheels that were high tech. But my suggestion is if just if you are able to go back to school, vocational rehabs are great programs that help you with any of these programs. So, all right. So Julie, do we have any questions that popped up that I need to answer online?
We got a question from Peter, and it says, How do I deal with limitations of outpatient rehab from insurance, as my wife thought I would get PTOT until I didn't need it again? 4 months in, T9, 10 incomplete.
Okay. Now, I'm not an insurance guru. My experience with insurance is that you need to be able to prove that you are continuing to improve, that there's some type of goal. They can't just keep sending to you, because no insurance is going to want to do that. But if you can find a way for your PT and OT to find to write down certain goals that you're trying to ascertain while you're in therapy, and as long as you are attaining those goals or finding ways to get better at it, they tend to approve of that. I mean, I don't know if they're gonna ever approve anything like my goal is to walk, but they are definitely more interested if there are specific goals. And I would talk to your PT and OT about that and say, look, what areas do I need to improve? What goals are, and then and have them write that down for your insurance for approval. But the reality of though is though, in these days, they're gonna eventually just not support it insurance wise, and they're gonna make it difficult for you to get funded for that. And so you're gonna have to fight them and find ways to appeal, and which takes a lot of work, I'll tell you. But that's the goal, to wear you out at times, so that you don't keep, asking for more money. But more PT you get, absolutely, the better it is. So I wish you luck on that. Okay. Great. Do we have a question by Craig? Is that available? No. Okay. Julie, anything else? Did I cover most of the things today?
Yeah, we have a question about how do you find your own purpose in life?
Wow, that's a great question. The Buddhist concept says once you find meaning in your suffering, then you will find happiness. So think of it, break that down. First, you suffer. Suffering is universal. Everyone suffers, just that we suffer at different things. And then once we find why we suffer and the meaning behind the suffering, there is a path towards happiness. That sounds so Buddhist, isn't it? So, yeah, I mean, what is everyone that had met me would say, well, we know your purpose. Your purpose in life is to teach and to help others with therapy. I have to say that just those two things don't really always make me happy. My purpose in life is that I hope to experience life at its most essence of everything, from people, from being outside in the sun. I just want to live life. And as I get older and getting to a point where I had less and less time, it makes me even want to do it more. So purpose is really personal. You have to find a way. It's an answer of you only can answer, but you have to try different things. So you have to definitely try different things to figure out what makes sense to you. In the beginning part of my life, my purpose was education. But as you evolve in life and you sort of change, I think our purposes change. So there's not one thing I can answer you, but I think you need to keep thinking about what makes you happy. One of my mentors in the past who died of throat cancer, I said to him, what would you do differently if you rethink your life? And he said to me, I worked a lot. He said, I love what I do, but I would have found more joy in my life. I would have rather find more things in life that may give me joy. So that's my goal right now. That's my purpose, finding joy in my life. Now I can say that because I have a job and, I don't have to worry about paying bills as much. It's harder to do that when you have to work all the time, but work isn't everything for me at this point. I just want to have joy in my life. So I hope I answered your question, Julie. Okay. So let's see. Craig Goodry just says he tuned in late and he just wanted to relate SCI research and regeneration. I'm going to say, Craig, it is about 5 years off. That's what they always say. It's going to come out of the Europeans, and so we're going to look towards the east, northeast. The Europeans come out with something, hopefully, that's going to, right now it's about the implantables, putting little devices in your body to make your life a little better. But the actual spinal cord regeneration, it made sense. I was taking a class on neuroscience the other day, and they said, why do we not have your brain regenerate cells? Well, here's the thing. Your nerves, all those little tentacles, it's what creates memory. And if your brain cell dies, you lose your memory. That's why brain cells don't regenerate, because they have to stay where they're at, because that's what gives you memory and your ability to think. So think of it. If they start dying off, you're going to start losing different parts of your memory. So that's why they don't regenerate. It made so much sense. It took me 30 years to figure that out, but I just learned that in one of my classes last week. So, but all right, it's 3:02. I want to thank everyone for coming today and trying this new process of video chats and recordings. I want to thank you. Let me know if today's session was good, bad. Please let me know. Please refer to your friends and about our foundation. Please take a look at the foundation, Christopher Reeve Foundation. I have a lot of material on there that will help out in your ability to live a quality life. So thank you. This is Dr. John. You can always contact me through the foundation, and have a great day. Okay, it's a beautiful day out today in the Northeast. Bye-bye.